the Italy pilot site is represented by the Monastero Foundation. Monastero is a public healthcare provider of the National Healthcare Service, and it's also a research organization. Monastero is a cardiological tertiary level hospitals, and we have 25 and perhaps more years of experience in development of IT system for patient data management and connected research. So our experience started from essentially our initiatives and also results of past European and national research projects that led us to give our EHR system to other hospitals, actually all the hospitals of the Tuscany region. So it's a real pilot because what is implemented in our hospital can be extended easily according to some, of course, constraints that we are solving to all the other 36 hospitals of the Tuscany region. Next slide, please. Thank you. So the starting point in 2023 was our EHR system that is a medical device class 2B that is the support to generate the discharge report. I forgot to mention that the specific objective of Monastero is to manage the download of the discharge report, and in that sense we are currently the only hospital or the only organization that is managing the discharge report for xShare. And the starting point was also a technological layer that are related with the national regulation and regional regulation. In Italy, in the last 10 years, we have a regulation that tell us to send the hospital discharge summary to the national EHR and the regional EHR in projection in the federation of the national EHR in a certain way, and that way was something that is a current regulation also for other countries and regions, that is the HL7 CDA. But with a special flavor, let me say, because lately we're reverted to the generation of a PDF file that is the direct representation of the digital document signed by the discharge physician. Of course, with the advanced digital signature. So what the Italian patient has in their hands right now is a PDF file with something in it, and that something is the structured document expressed in the CDA Release 2 version. So this was the initial starting point. The second point was the patient portal. In 2019, right before COVID, essentially, we developed a patient portal to connect our, let me say, high availability of data with the patient capability, somehow to overcome some limitation provided or defined by the regional EHR system. So in that patient portal developed as a web application, so you might use it specifically as a web application because that was a precise requirement from our patients to use it on their smartphone, but also on computers for, let me say, try to solve some vision limited problems. So there you have the availability of all the information that you can find as a clinical document, just like the discharge summary. But in that version, and since since the starting of the xShare project, we didn't give the functionality of downloading the structured version of the document. So we give the availability only of the PDF digitally signed format and the CDA, but not the HRXF format that is in HL7 file. So in that was the initial point. Next slide, please. What we have done in the xShare pilot is to, first of all, analyze what might be the best way to convey the, let me say, yellow button, because at the graphical standpoint, we might have choose for something more complex, something that allow, let me say, IT people a plain implementation, but with some shortcomings from the final user, because we consider also patients with a huge digital gap in the usage of IT platforms. So that is our solution that you can see on the right-hand side of the slide. So the yellow button is corresponding, we have several yellow buttons essentially, one for each document that you can download singularly in the HRXF. So if you click on the slide, perhaps we have okay, something again. Okay, again. So I will show you all the arrows. Sorry, I forgot that I put some animation here. So you might find both words, the words that preserve the national regional regulation to download the PDF format with the CDA embedded, or technically called injected, and the second way to download the EHRXF format of the same document. So with the yellow button, you can directly download the JSON file, let me say, and try to store it, or decide where to store it in your device, either the smartphone or your personal computer. But we added also the capability, and in a sandbox environment, in order not to alter, of course, the respect, the compliance with the regulation, to download the PDF and embed there not the CDA version of the discharge summary, but the FIRE version of the discharge summary according to the implementation guide for the HDR. So this is something that, again, was decided with our patient, and this is the simplest way that we adopted to open the door for the direct data portabilities. We considered also some other features, and this is perhaps the next steps in the xShare project, essentially the description of these new features for the information document for data managers, because of course we are giving the data owner the responsibility to maintain their own data. Of course, they have the full right according to Article 20 of GDPR to have that, but we need to, let me say, train a bit the patients in order to tell them how they can dispose of that with the basic download functionality. The other steps of Smart Earth link or one-time share or permanent link is perhaps much easier to be defined, because define also an architectural schema that we might refer for data exchange with other hospitals or with other healthcare professionals. Next slide, please. So we have an impact in our community of patients, and we are talking about patients that are traveling across Italy because of the tertiary level of the cardiological center, and we provided the simplest way to the data exported in the EHRXF format, and the positioning, the graphical, let me say, implementation of the yellow button was something that took some time to be defined, and then was established as the best, also according to some initial feedback from the patients. Of course, we use that as a hospital for continuity of care with other hospitals, but also with the primary care. But we addressed also some biases, the cultural or behavioral, you can see in this both sides of giving, and this is something that the patient really like, the possession of their digital things, the digital reports directly for their own autonomous usage and independent usage. So this is something that represents for them a smooth transition from paper, because currently we also use sometimes paper reports, of course, and this is somehow also to bridge this huge digital gap for all the patients. This is also because sometimes the IT platform are implemented perhaps in a too complex way for patients. This is something that might represent an obstacle to be addressed for the future. Thank you.